root of the nose, bridge of the nose, alar cartilage, philtrum, bringing the air up into the nose. External nares is right here. Done. Dude, we did it.
Ready, set, go.
Nasal cavity right here. Nasal vestibule right here. Nasal septum is right here, separating right from left nostril. Hard palate or palatine bone right here. Cribiform plate is right here, right behind the crista galli. Nasal meatuses is superior, middle, and inferior. Paranasal sinuses is the frontal, inferior. Paranasal sinuses is the frontal and frontal right here, and up here would be frontal as well, nasal sinus, and on this one, frontal nasal sinus. Ethmoidal sinuses, right here. Right here. Sphenoidal sinuses are right here. Right here. And right here. And the maxillary sinuses are right here. Internal nares and soft palate.
Go.
So pharynx is from here to here. The nasopharynx is from the internal nares to the soft palate, so here. So this area right in here. Nasopharynx. Opening to eustachian tube is right here. Oropharynx is from the soft palate, so here, to the level of the hyoid bone, to here. So it's from here to here, even with the hyoid bone. And the laryngopharynx is from the base of the hyoid bone, right here, to the base of the epiglottis, right here. So just this space through here.
Go.
So the larynx runs from here to here. And then thyroid cartilage is here and here, wrapping around. Cricoid cartilage is right here, wrapping around posterior. The epiglottis is here, epiglottis. The glottis is this right here, all of this here. We have our false vocal cords, which are superior, and then our true vocal cords, which are inferior, and the rima glottides is the space between the two true. So, larynx, its whole structure, thyroid cartilage, here, cricoid cartilage, right here, going around posterior to here. The glottis, epiglottis, right here. The glottis is all of this in here. The false vocal cords would be on top right here. They're not on here though. The true vocal cords are here and here. And the rima glottides is the space in between here, spatial area, leading into the trachea. Good. Tracheal cartilage rings. Carina, right at the split. Primary bronchi. Secondary bronchi. Tertiary bronchi. Apex of the lungs. And base of the lungs.
You want the lungs?
Costal surface of the lungs. Mediastinal surface of the lungs. Cardiac notch. It's on the left lung. Pulmonary hilus is this guy, this area. Okay. So right lung has 3 lobes. You can't see them on here. Left lung has 2. The horizontal fissure would be on the right lung, running right this way, like this. Is it up there? There it is. Okay. And the oblique fissure is right here on the left lung. Lobule, alveolar duct, here, 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 and here. Alveolar sac, here.
Move it too, hang on.
Thoracic cavity.
Where?
All of this with the
Are you
lungs
sure?
are in. Well, kind of. Pleural cavity. Diaphragm.
Sure it goes like that, probably. It's gotta go right here.
Visceral pleura is on top of the lung. And the parietal pleura isn't on here, but it's the inside of the thoracic cavity that the lung goes up against. Vermilion is right here. Color of the lips. Oral vestibule is the opening in between here. Gingivae will be the gums, which we don't really have on here, but it would be up in here right above the teeth. Hard palate, soft palate, uvula, tongue, labial frenula superior is right here. Labial frenula inferior is right here. Lingual frenulum is the floor of the oral cavity, so right here attaches the tongue. And the crown, neck, just this little portion. Root, areas of the tooth. Enamel, the white. Dentin, the yellow. And cementum, you can't really see, but it's this white on the right side holding the tooth in. Root canal is right here. Apical foramen is this opening right here for the nerves. So right here where the nerves will run down. And pulp cavity in here.
Go.
Parotid gland goes in here. Sublingual gland is on this one right under the tongue. And submandibular gland is right here under the mandible. That's it.
Go.
So pharynx is from here to here. The nasopharynx is from from the internal nares to the soft palate, so here, so this area right in here, nasopharynx, opening to eustachian tube is right here, oropharynx is from the soft palate, so here, to the level of the hyoid bone, to here, so it's from here to here, even with the hyoid bone. And the laryngopharynx is from the base of the hyoid bone right here to the base of the epiglottis right here. So just this space through here. Upper esophageal sphincter.
Me either. Never, not once in my life. Never had that.
And lower esophageal sphincter. Pyloric sphincter is right here.
When they got like the presents, like it was like a peanut butter and jelly sandwich.
The lesser curvature
And then
is right here.
girl, and she's like, I like your dinner, but
Greater curvature
I like it when you cook
right here.
dinner, but not when you give
Gastric
it to me
rugae
as a present or
right here.
something like that.
This is the duodenum right here. Let's take this off. All the way running through here. And then the jejunum is the top left part area. And then the ileum is the rest of the right side. And then the villi is this right here.
You guys are killing us.
Oh, sorry.
Right here. Villi. And then the microvilli is those little
There you go.
stubs right there. And then lacteal is right here.
Ileocecal valve. Cecum. Appendix. Ascending colon. Transverse colon. Descending colon. Hostra is one of these separate patches. Taenia coli is this muscular band. Sigmoid colon is this portion right here. Sigmoid colon. Rectum is this portion right here. Anus is right here. Anal canal is right here. And we can't see the anal sphincter. Okay, right lobe.
Where's the left?
Quadrate lobe. Quadrate lobe. Left lobe. Right hepatic duct. Left hepatic duct. Common hepatic duct right here. Cool. Cystic duct right here. Common bile duct is going into the pancreas. Or cystic duct, or the common bile duct here, and it'll come down and go into the pancreas. Okay.
Pancreatic duct right here. And then the ampulla of Vader.
Oh, that's a good radio voice.
And
right
then
there.
sphincter of Odin.
Newscaster.